Welcome, everyone. We'll get started now. And welcome to the Technical Assistance Network for Children's Behavioral Health, Cultural Linguistic Competence Peer Learning Exchange. The Peer Learning Exchange is a webinar or monthly call with topics focusing on culture, health equity, and disparities in children's behavioral health. Topics are generated by you, individuals working in or being served by behavioral health organizations and partnering with system of care states and communities. Today's webinar is titled, Plan Your Work and Work Your Plan Using the CLAS Standards. We will be learning how to draft CLC plans and other strategic planning documents that align with the CLAS Standards. And we will also be exploring ways to implement the CLAS Standards in service delivery. The webinar today is brought to you by the TA Network and the National Training and Technical Assistance Center for Children's Behavioral Health, TA Network for short, and the Substance Abuse and Mental Health Services Administration. My name is Catalina Booth, and I am the Executive Director of the Center for Community Learning in Miami, Florida. The Center for Community Learning is a key partner in the TA Network. The Center for Community Learning focuses on providing training, technical assistance, research, and program evaluation on issues affecting diverse and traditionally underserved communities. As a partner in the TA Network, the Center for Community Learning provides technical assistance in the area of cultural and linguistic competence. Our expertise focuses around issues of language assistance, CLAS standard implementation, community capacity building, diversity and equity training, behavioral health literacy, and reducing behavioral health disparities. In my role as a member of the TA Network, I focus my work on CLAS standard implementation, designing materials and sessions like today to educate administrators, practitioners, and behavioral health consumers regarding the history and purpose of the CLAS standards, as well as how to implement the CLAS standards at all levels of the organization and service delivery. My co-presenter is Selena Webster Bass. She is a native of Jacksonville, Florida, and has served as a health advocate for over 15 years, promoting the national standards for culturally and linguistically appropriate services. While serving under the Jacksonville System of Care Initiative, Substance Abuse and Mental Health Services Administration Implementation and Expansion Grant, Selena worked as a cultural and linguistic competency educator for over 5 years. In this role, she facilitated professional, family, youth, professional development in areas of cultural and linguistic competence. She conducted CLC organizational self-assessments, integrated system of care core values and wraparound care coordination, and promoted multicultural community engagement. Selena Webster Bass's background is in public health, cultural and linguistic competency, behavioral health, and faith-based engagement. She is certified in adult and youth mental health first aid and works with various community organizations promoting mental health literacy. She's currently the CEO of Voices Institute, a consulting, curriculum development, and research group focused on multicultural consciousness, equity, and well-being. She is a core partner in the TA Network, and she's here with us today and will present the second part of this webinar. Today's presentation is being recorded. Your lines will be muted right now to help eliminate the background noise. So feel free to use the chat box to type in any questions or comments during the presentation. Following my presentation and Selena's presentation, we'll open the lines for questions and discussion. And as a point of clarification, as another administrative point, that after today's webinar, our partners at University of Maryland who provide the technical aspects of this webinar will be putting a survey up on the screen for participants to complete. So watch for that at the end, and we'll cue you when it's time for that. Without further ado, let's start on today's learning objectives. We've got 3 learning objectives today. First, to understand the practice of using strategic planning process that aligns with the CLAS standards, which will help us learn how to structure CLC plans and other strategic plans that implement the CLAS standards. And finally, we will explore ways to implement the CLAS standards in service delivery. In today's webinar, we're not going to go over the CLAS standards standard by standard. We will give a basic definition of what they are, and we'll discuss some of them as examples as we show you the strategic planning process we are recommending. We if you need further, if you need a more in-depth look at the CLAS standards individually, or there are a particular set of CLAS standards that you would like further training on, the TA network, the CLC team for the TA network has a series of webinars, and we put the link in the public chat box. And this is the CLC playlist on YouTube, and it includes all of the webinars that we've done, and you will find a series of webinars that we did in the last 2 years regarding the CLAS standards. Also, in a few minutes, we're going to be doing a group exercise, and I'll draw your attention on your screen. In the middle of the screen at the bottom, there's a box that says Files, and then there's some files available for download. Those are all files that you can download with resources. During the webinar today, we're going to do a group exercise, and you might find it helpful to download 2 of those and even print out 2 of those resources. One is a list of the CLAS standards, and the file is called Enhanced National CLAS Standards. And 2, the file called Group Exercise 1 Worksheet. If you have the time and are so inclined, it might make things easier and move things along. If not, we will. If you're not able to, we will also show it up on the screen. So what are the CLAS standards? The National Standards for Culturally and Linguistically Appropriate Services, commonly known as the CLAS Standards, are a set of guidelines and mandates established by the U.S. Department of Health and Human Services. The CLAS standards are designed to advance health equity, improve quality, and help eliminate healthcare disparities by providing a blueprint for individuals in health and healthcare organizations to implement culturally and linguistically appropriate services. The best way to think of the CLAS standards is as a starting point for the organization. They help create common ground and a starting point for behavioral health organizations. And their guidelines are a framework set in place by the federal government. But for those of you who have already taken our webinars on language assistance, you all remember that certain of the CLAS standards, the ones with language assistance, are not just merely guidelines, but are actually mandates. And those are the ones that deal with language and communication assistance. The goal, and one of the primary reasons why we're hosting today's webinar, is because we've received a lot of requests for technical assistance in the areas of implementing CLAS standards at different levels of the organization. And because, frankly, this is something that SAMHSA has been looking at carefully during their site visits, see how the CLAS standards are incorporated. So the goal is to implement CLAS standards at all levels of the system of care, from the policy level to the frontline practice level to the community level and management level. Well, why do we want to do that? Well, according to Terry Cross's monograph, Towards a Culturally Competent System of Care, the culturally competent system of care is made up of culturally competent institutions, agencies, and professionals. The culturally competent system values diversity, has the capacity for cultural self-assessment, is conscious of the dynamics inherent when cultures interact, and has institutionalized cultural knowledge, and has developed adaptations to diversity. Further, each of these 5 elements must function at every level of the system. Attitudes, policies, and practices must be congruent within all levels of the system. When the CLAS standards are implemented at all levels, they make Terry Cross's culturally competent system of care a reality, because the CLAS standards create a blueprint of actionable objectives. And today we're going to show you a recommended practice on how to structure strategic planning documents that incorporate the CLAS standards. The strategic planning process for a CLC plan or other strategic planning documents for the system of care begin with gathering data and getting input from stakeholders. And these 2 items happen simultaneously. It's important to gather data at the same time as you begin to incorporate input from stakeholders. Once you've gathered data through assessment and data collection and have received input and gotten buy-in from stakeholders, including youth, families, parents, caretakers, and faith organizations, you can move to the third box, the blue box, which is drafting CLC goals, objectives, and action steps that align with the CLAS standards. The data and community input you received will inform your goals, objectives, and action steps. A key point here is that your goals, objectives, and action steps must align with the CLAS standards. And what do I mean by this? I mean that the CLAS standards should form the organizational structure of your CLC plan. They're the skeleton. Then your objectives and action steps fill out that skeleton. And then the next step in the strategic planning process is the implementation of your plan and then your assessment. And then the process begins all over again in a cycle of continuous quality improvement. So how do you use the CLAS standards as the framework or as the skeleton for your strategic planning and your CLC plan? Well, you do so by using the CLAS standards to inform your goals and to flesh out your objective and action steps. As they form the framework, the first step in the process is drafting clearly established goals, objectives, and action steps. And I pause here to remind everyone that there is a difference between goals, objectives, and action steps. I know we use them interchangeably, but they're different, and we want them to stay differently to help us get from a wide lens down to actionable action steps. A goal has two very important features. They're broad and written sweeping language. A goal is about the long-term future, what you want, what you or your organization would like to see down the road. So goals are long-term and forward-facing. Objectives differ from goals because they're more specific, and they talk about the immediate future and what you want to do to achieve your long-term goal. Finally, the action steps support the objective and are the things you will do right now to implement your objective. In the next few slides, we're going to explore how goals can align with the CLAS standards and shape your strategic planning. But before we do that, we're going to do a brief poll, if we could put that up. For those of you who might have some familiarity with the CLAS standards, or those of you who have them printed, which of these goals listed on the poll align with the CLAS standards? Reflect and respect diversity, provide language and communication access, build community partnerships with diverse groups, or all of the above. I'll give you guys a minute or two to click in your answer. The answers keep rolling in, but overwhelmingly, yes. Most of you voted all of the above, and that is correct. The purpose of this action, and I'll let everyone keep finishing their vote. The purpose of this poll was to get you thinking about the fact that the goals that you probably already have on paper or are thinking about including in your CLC plan, strategic plan, and other strategic plans are already aligned with the CLAS standards. So now we just have to formalize that and put that in a way that we can move forward. Now that the poll is closed, we'll go back to the presentation. Sorry. We are going to do a brief group exercise. Able to pull out the CLAS standards. We have a list of CLAS standards that you can print, and then there's a goal worksheet. What we're going to discuss a little bit is what goals are going to fit under each, what CLAS standards fit under each goal. And the group exercise one sheet, which we'll do very briefly here, but this is an exercise that you can do with your teams when you return back to your organizations. I've listed here 6 goals that appeared in a CLC strategic plan for a behavioral health organization. And they created these 6 goals. And now what we're going to do is see which CLAS standards fall under each of these broad broad goals. So, oops, that should have been, okay. I'm not going to move to the next one because the next one has all the answers. I thought they would come in animated one at a time, the answers, but that's fine. So the first goal is foster cultural competence. Looking at the CLAS standards, if anyone out there can point to one of the CLAS standards that would help you reach your goal of fostering cultural competence. You can type in if anyone is unmuted themselves, or you can type it in. Some folks are typing in, so I'm going to give the folks typing in their answers a minute to answer that. And can you put up the CLAS standards? It might help everyone if we had the CLAS standards up instead of this slide. That might help it. Okay, if you look at principle standard number 1, it states that that CLAS standard is to provide effective, equitable, understandable, and respectful quality of care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. When implemented, that principle standard would help you achieve your goal of fostering cultural competence. Another example, since y'all are quiet today, another of the CLAS standards that would fit under the goal of fostering cultural competence are CLAS standards 2, 3, and 4. So all of the governance, leadership, and workforce CLAS standards, when implemented, when you recruit, promote, and support a culturally, linguistically, and diverse governance, leadership, and workforce, that is one way of fostering cultural competence. So we can go back to the slide. Someone typed in and said number 4. Exactly. Number 4 is also a way of educating and training governance, leadership, and workforce, is a way of fostering cultural competence. So this is a tool that you can use when in your resources. Group exercise 1 document that's available for download is blank. If you want one that's filled in, it is goals aligned to CLAS standards. So in your organization, you can draft your own goals and then align the CLAS, and then put CLAS standards under that. And I'll show you how that helps you draft your objections and action steps in the coming slides. Again, here are the answers, but you have that printed in the downloadable file called Goals Aligned with the CLAS Standards. Let's take a look at now that you create a skeleton by creating goals that are, and then aligning the CLAS standards under those goals. But how do you now create objectives? Well, objectives have to be SMART, and they have to be specific, measurable, achievable, relevant, and trackable. I have here on the screen an objective that would help meet the goal of fostering cultural competence. So if this objective is in your organization and you create action steps, then you'll be able to achieve your goal of fostering cultural competence. This particular objective of increasing the capacity of state agencies and service providers to support implementation of the CLAS standard among all providers, contractors, or grantees providing services to children, youth, young adults, and their families is a SMART objective because it sets out who the target audience is right there in the objective. It tells you the target audience is state agencies and service providers, and it tells you who the beneficiaries are, the providers, contractors, or grantees. So by telling you who the audience is and who the beneficiary is, it is specific. It is measurable because it's quantifiable. In other words, you can put numbers to increasing capacity. Also, it's attainable because it's a specific goal. And it's relevant because it addresses a key goal, CLAS implementation. And it's also realistic because it's not in lofty terms. Now, I'll be honest with you, this particular objective can be sharpened down even more, and it could be made even, quote unquote, smarter with more specifics, setting out what increased capacity actually means. But I show it to you as a way to explain to you the process of taking goals, shaping them with the CLAS standards, and then creating objectives to meet those CLAS standard-based goals. What we're doing here is what I call the funnel technique in CLC planning. For those of you who haven't heard me speak before, my background is as a trial lawyer. I was a trial lawyer for, I don't know, 15 years. And one of the things I was taught in basic deposition class was the funnel technique in depositions, that you start with broad questions and you get down to specific questions. And it's those specific questions that are going to give you the meat of your arrow, and then your fine point where the rubber meets the road is your action steps. In order to create specific action steps, you need to ask during the planning process a series of questions. And the first two questions deal with looking back at the past. What have you done in the past, and what facilitator strengths or resources already exist? And in the strategic planning process, when you ask these questions and answering these questions, the answers to these questions are going to give you your action steps. Then you need to figure out once you know what's been done in the past and what's in place already, you need to take a look at the key players. Who are the stakeholders and how will they be engaged? And then in number 5, you need to look at the resources needed. Then you can look at what policy changes need to be made. And then questions 7 and 8, you look at the challenges and obstacles and how you can overcome them. In question number 9, what outcomes in the short term, medium term, and long term do you want to get at? And then finally, how you can measure outcomes and show completion. I'm going to walk you through a quick example of how these questions can help you. For example, we talked about the previous objective that we talked about in the previous slide of increasing the capacity. Well, the question answers who the stakeholders are. The stakeholders are providers, contractors, grantees, children's, youth, young adults, and their families. And the resources, the next question you would want to ask yourself is what resources would be needed. For example, some resources that may be needed to make this objective a reality are budgets, money, materials, schedules, and time. So then you would ask yourself the question, what challenges do we have? Well, in order to increase capacity, we need to give training, but in order to give training, we need to have training that is scheduled at a time when our children and youth and young adults and their families can come. So in answering these questions, you learn what's needed, who it's needed for, and what your challenges are. And because you have based them on the CLAS standards, you're ensuring that you have a framework that moves you towards cultural and linguistic competence. I'm going to race through this next one to make sure that I leave enough time for Selena, but this is another example of drafting objections and action steps. The goal, in this case, the goal that the organization had was to ensure cultural and linguistic competency strategies are fully and consistently integrated into policies, practice, procedures, and programs throughout the division. This is the kind of goal statement we see all around a lot. If you just leave it at that and you don't have more specific objectives, strategies, and action steps built around the CLAS standards, you kind of get stuck. And the goal just sits on paper and never becomes a reality. So the hope is to use what we're teaching you here is ways to use the CLAS standards to create objectives, or also known as strategies and action steps that will actually come to life, that will actually be implemented and be effective. In this case, the CLAS standards that would apply is underneath this goal would be standard 2, which is to advance and sustain organizational governance and leadership that promotes class and health equity through policy, practice, and allocated resources. And standard number 9, which is to establish culturally and linguistically appropriate goals, policies, and management accountability, infusing them throughout the organization's planning and operations. So what is one way that you can advance and sustain organizational governance and establish culturally and linguistically appropriate goals that are responsive to people's needs? Well, one way that we've seen agencies do this successfully is to create a cultural linguistic competence committee that advises the board regarding cultural diversity and CLC policies. So we have some organizations that get the goal statement figured out. They even get the objective or the strategy, which is to create the CLC committee, down, but then they get stuck there. So if you then take your CLAS standards and make those into action steps, you can see that in order that some of the action steps you might want to implement in order to make this objective and this goal a reality is to recruit community members from the following groups. So in your action steps, you would actually describe who you want to be included in your CLC committees, and you would also describe how you're going to recruit those. And you would give yourself, your organization, timelines and a framework to make that a reality. In your, can you put up the Ohio Department of Health document real quickly for me? This is the Ohio Department of Health, one of their units, Cultural and Linguistic Competence Planning and Capacity Building. I've included it in the resources because it's a good example of how to organize your plan. What they did is they took the CLAS standards are divided into 3 themes. Leadership, governance, and workforce is theme 1. Theme 2 is language services and communication assistance is theme 2, and theme 3 is engagement and communication. Well, what Ohio did is they created their plans around 4 goal areas. They further broke down the CLAS standards themes and created goals for each one of them. Then, under each goal, they had at least one strategy or objective, and each strategy had a clear action step. So you have that available here as a sample. Could we switch to the sample CLC plan from 2015? And when you see in a minute, when the plan comes up, this plan lists each CLAS standard as a goal. If you see here, this is their plan. This is their CLC plan. Their first CLC goal is to provide effective, equitable, understandable, and respectful quality and services, care and services that are responsive to diverse cultural health beliefs. Then each goal, or they call it domain, is supported by various objectives or an action steps here. Then they spell out the method for assessing progress, the date that it's due, and the staff responsible. And here they're actually named by person, but I've vetted it. They've allowed us to use this as an example. They just asked to edit names. So this is one way that you can directly put the CLAS standards straight into your CLC plan and simplify things. And the last tool that I wanted to show you before I turn it over to Selena is the CLAS planning worksheet, which is listed as the Maryland she's loading it up for me here. This is a tool that you can use with your stakeholders. It's under implementation resources, and it is a CLAS planning worksheet. Let me get to a blank page. And what they have done for you, and you can even further tailor it, they have created 6 goals, 6 goals: foster cultural competence, reflect and respect diversity, ensure language access, build community partnerships, collect diversity data, and benchmark, plan, and evaluate. So they basically took the CLAS standards themes and they created titles for each group of CLAS standards. And so the way you can use this in your strategic planning is the action plan sets out the goal. This first goal is to foster cultural competence. It lists the specific class standards that apply under that goal, and then it allows you to write down, or your team to write down, action steps to be taken to meet that goal. The resources needed, the person responsible, the indicators of progress. And so this can be used as a way to draft your CLC plan. And your CLC plan would end up looking a lot like the example we just looked at. So in this section, we've focused and given you tools on implementing the policies and procedures at the management level. We can switch back to the presentation. Now I'm going to turn it over to Selena, and this next part is the next step, which is crucial, which is not stopping the implementation of the class standards just at the policy that's put in a drawer, but actually implementing the class standards in the service delivery. It's what we call working the plan, making your class-based CLC plan or strategic planning a reality when it comes to service delivery. Selena?
Thank you, Catalina. Catalina has highlighted several useful tools for creating CLC plans or roadmaps or guides and operationalizing CLC. I will discuss examples of CLC plan action steps from a local system of care community specific to wraparound care coordination. And these examples align with standards 9 through 15, which focus on engagement, continuous quality improvement, and accountability. And these three themes are critical because they focus on the supports that are necessary for successful implementation and maintenance of culturally and linguistically appropriate policies and services. The CLC plan action step examples that I will discuss are specific to service delivery and will focus on the standards that are highlighted in blue. So Standard 9, which is infusing class goals, policies, management, and accountability throughout the organization. As Catalina has said, it is necessary that cultural competency is integrated at all levels of the organization, including your organizational values, external and internal communication, human resource management, of course service delivery, which we'll highlight, and communication and language access. The second example will focus on Standard 11, which is to collect and maintain demographic data. And the third example will focus on Standard 13, which is partnering with the community. So this slide shows a screenshot of a CLC plan from a local system of care community. The emphasis of this part of the CLC plan is service delivery and again aligns with CLAS Standard 9. As you can see, the first action step is to draft service care plans, which include the identification of familial preferences for and availability of traditional healers. So this particular action step is focused on actually documenting cultural competency within the care plan, documenting cultural preferences, language access needs, cultural specific support groups, and even relationships and networks that are used with cultural brokers and multicultural providers. So some examples of cultural preferences may include extended family involvement, dietary preferences. Oftentimes wraparound coordinators are bringing food to the home, so knowing if there are certain religious restrictions, use of traditional healers and practices, use of faith and spirituality as a coping mechanism, if there's a need for interpreters or translation services or American Sign Language needs, cultural specific support services, for example, maybe a mentoring program for African American males, and then even the need maybe to connect to ethnic community-based organizations that are in the community. So again, this action step focuses on actually documenting in the service plan cultural considerations that may be needed to assist the family in reaching their family goals. The time frame here is ongoing. Persons responsible, you can see that this is a multidisciplinary approach. Clinical directors, the wraparound consultant, the CLC lead, as well as other members of the wraparound team, which includes the family engagement lead and the youth engagement lead as well. So again, CLC is not just the role of the CLC consultant or the lead, but it's the role of all members of the team. Supportive activities in terms of this particular action step are for wraparound team members to assess for cultural strengths and preferences, which are also to be integrated into the care plan. One of the things that this particular system of care community instituted in order to make sure that cultural competency was being considered was to add a cultural considerations box to the care plan. So to make sure that this information just wasn't being collected in order to check the box for drafting a service plan, but making sure that it's actually a part of the work of assisting the family in meeting their goals. Part of this process was also conducting case reviews during clinical meetings. So there was, really intentionality about thinking specifically about family traditions, family values, and the role of key decision makers in the family as well. So this is one example of an action step specific to service delivery and the CLAS standards. The next action step on the screenshot is specific to eliciting information from the family or conducting a standardized cultural assessment. This standard or this action step says to include a standardized cultural assessment in each chart to identify cultural strengths and needs across the life domains. This information should be elicited from the family so that cultural considerations are made to improve the well-being of children, youth, and families. So, of course, this is an ongoing process. Again, this is a multidisciplinary action step. It's not just the role of the CLC consultant or the wraparound coordinator, but this is, again, something that all team members should be involved in. Supportive activities, there's a specific assessment that was being used, the New York Mental Health Hygiene Cultural Assessment. This was included in every chart. In addition, the cultural assessment was a specific color in the chart so that it could be easily identified, and it was used to address the cultural needs of the family and making sure that that information that was collected was, again, linked back to the care plan to make sure that there was integration. Some of the supportive activities related to this cultural assessment were, one, making sure that the wraparound coordinators knew how to ask the questions, so there was training provided to staff on, the best way to ask, questions about cultures. So this was a part of the professional development piece as well, and, how to elicit information in a sensitive way. All right, so here's another screenshot from a local system of care CLC plan specific to collecting demographic data. And again, this is specific to Standard 11, which is to collect and maintain accurate and reliable demographic data to monitor and evaluate the impact of class on health equity and outcomes to inform service delivery. And this is a really important standard. All of them are important, but this is important in terms of, one, knowing who's being served, identifying who your populations of focus are, and being able to monitor the individual needs of youth and families, being able to identify specific barriers to care, understanding utilization patterns, outcome patterns such as no-show rates or recidivism rates. And so reviewing this information so that we can improve service planning and enhance care coordination. Also being able to tailor services to specific populations and being more responsive to cultural preferences. All right, so this action step says to collect and enter child, youth, and family data by race, age, sex, zip code, ethnicity, language preferences, religion, faith, sexual orientation, gender identity and expression, or SOGI as we term it, resident status, and other cultural demographic variables in treatment records and within the management information system through EDIF and NOMS, which is evaluation tools that many of our system of care communities use, and compiled by the evaluation team. So this action step, of course, is ongoing. Responsible folks include the clinical director, the wraparound team, wraparound lead, as well as the evaluation team is an integral part to this particular action step as well. Activities, the CLC coordinator identified the cultural variables to be collected. So there was lots of discussion about, how these questions should be asked on the form. What are the specific data fields that we'd like to collect, so how this information should be shared with members of the care coordination team. We also had training on allowing for self-identification, not making assumptions based on visual cues about identity characteristics, and consensus about, what is identity for our system of care. It has to go beyond race and ethnicity, and it should be inclusive and broad of many of the cultural categories that I've mentioned earlier. Some of the other topics that were discussed specific to this action step were, specific to the LGBTQ population and understanding, the difference between gender identity, gender expression, sexual orientation, and, training on how to ask those questions of youth and families, and making sure that those questions were just, a part of the demographic section of forms, that it wasn't a separate process, but it was part of understanding, understanding who our families and who our youth were and how they identified on their terms. So the last set of action steps I'd like to highlight are specific to CLAS Standard 13, which is partnering with the community to design, implement, and evaluate policies, practices, and services to ensure cultural and linguistic appropriateness. And so I like to refer to this standard as nothing about us without us. So it means that, the services should be informed by community interests, and that community interest should include families, youth, multicultural partners, diverse networks, ethnic community-based organizations, providing input on how services should be provided, and providing understanding of the cultural needs of the populations that are receiving services. So there's really this interdependent relationship among all of the system of care core values. Cultural competency is at the foundation of the system of care core values, but yes, we should include diverse families and youth to inform the processes that are involved in providing quality services. So again, the CLAS principles and activities should be integrated throughout the systems of care and undertaken in partnership with diverse youth, families, and multicultural communities that are receiving services. So here are examples of action steps specific to youth, family, and community integration. The first one focuses on educational materials. So one of the action steps for this system of care was to review pertinent written youth and family materials to ensure that they are interpreted from the appropriate cultural, family, and youth perspective. So again, this gets to health literacy and making sure that information is conveyed in a way that's understandable to the families. And so members from the Youth Move organization, members from the Federation of Families organization were a part of the CLC committee, and this was one of the functions of their CLC committee, was to have family members review materials and to provide feedback on, whether the materials were appropriate or whether the information was understandable and so forth. So again, this is an example of an action step involving community organizations, involving youth and families. The next action step is to ensure meaningful family and youth participation in continuous quality improvement processes by identifying family and young adults to serve on the evaluation committee. And so, initially the evaluation committee for the system of care was, your traditional folks, your CQI director, your clinical director, your wraparound team lead, of course, your, evaluation team lead. But eventually, the evaluation committee evolved, and members of Federation of Families were a part of that committee. Youth Move members became a part of that committee, and we began to look at satisfaction data and other outcomes based on race, ethnicity, and even zip code, and identifying patterns and ways that services could be improved. And so this was an ongoing process. It was just wonderful to have, family and youth to provide a different lens in terms of service delivery. And of course, we included family and youth that were diverse, from our Latinx community, from our African American community, from our LGBTQ community, so that we had, diversity in terms of the individuals that were a part of this team. The next action step is identify youth caregivers and peer support to participate in the development and delivery of cultural and linguistic competency training activities with emphasis on diverse health beliefs, traditions, cultural practices, multicultural groups, and systems navigation. So again, there was a training committee, and initially the training committee was your traditional folks, your clinical leads, your wraparound team members, representatives from varied mental health and behavioral health organizations, the CLC lead. But, again, this committee evolved, and we began to add families and family members and caregivers, and youth became a part of that committee. And they actually helped design cultural competency educational materials. And here are 3 examples of materials that were developed in collaboration with diverse youth and family members. There was a refugee immigrant populations and culture training that was offered, and several families that had recently migrated to our area shared their path to the United States, some of their experiences with war, some of their experiences in terms of trauma, and so it's really a wonderful presentation. The second training was focused on LGBTQ and creating safe spaces for youth in schools and clinical settings. And a local sexual minority youth network organization was a part of the development of the training. LGBTQ youth were a part of the training, as well as an academic partner, University of North Florida, that helped in the development of the training or assisted in the development of the training as well. And then the final example is the Youth Risk Behavior Survey and Suicide Prevention Training. This was a partnership with the local Department of Health and our Youth Move organization. And so many of the youth shared their personal stories about living with mental health challenges, and data was shared from the Youth Risk Behavior Survey showing various disproportionalities across various diverse groups, particularly the Hispanic and African American LGBTQ populations. So again, these are 3 examples of action steps under the theme of youth, family, and community integration. These are just some visual examples of the action steps that we just mentioned. The first picture is one of the Youth Move members speaking about her experiences of integrating spirituality and behavioral health and what that means to her. The second picture is a panel involving various faith-based partners addressing the integration of spirituality and behavioral health and building a bridge between behavioral health providers and the faith-based community, establishing referral networks, et cetera. Mental Health America of Northeast Florida was also a partner with that particular event. And then the last picture is from the Youth Risk Behavior Survey training with Department of Health, and where we had several testimonials from our Youth Move group, as well as resources for providers and various community agencies in the community. Okay. So creating a CLC plan it should really be a deliberate and intentional process. The plan is a living document. It's dynamic, it's changing, and it should be changing as, our populations or demographics may be changing in our community, as we tweak, as we do our continuous quality improvement process. So it's really important that, that plan is being reviewed on an ongoing basis and that we're updating to make sure that we're meeting and addressing the cultural needs of our families. So I like to end with the thought, a goal without a plan is just a wish. We have some resources here for you as well. Catalina shared the Ohio CLC plan, but here are some other resources specific to the CLAS Standards and CLC plan development. And if there are any questions, feel free to type them in the box and we will address them as we can. Thank you.
Selena, there's one that has been asked that I know because you and I have talked about this one before, and it is, as an organization, how do you entice families and youth to be a part of a CLC committee and offer their perspective?
Okay. So the recruitment of youth to the CLC committee was mainly through the partnership with the Youth Move organization, which was the oversight for that organization was through Mental Health America of Northeast Florida. Part of involving youth with the committee meant that there had to be some prep work before meetings occurred, so we just don't throw youth into meetings and expect them to contribute in a meaningful way. So within this system of care, the youth engagement lead would meet with the youth, participants that would be a part of the CLC committee and explain to them what the objectives and the agenda, were for that particular meeting and discuss ways that they could contribute to, the CLC committee. So again, I think it's important to, have that prep time. You don't want just one youth that's part of the committee. Typically, we had 2 to 3 youth at a time so that they didn't feel uncomfortable or isolated, because it can be a little intimidating to have, several youth, or to have youth in a setting with several professionals and providers and CEOs and clinical directors. And so I think that's important. And on the other side, I think it's important to educate the CLC committee members about the value of youth participation, the value of family participation as well. The youth gave us wonderful input in terms of ways that we could improve services. One thing I remember from the meetings that they said, they asked the same questions over and over and over again. Is there a way that they could just, take the information from one form and share that with everybody versus everybody, asking the same questions over and over and over again, so again, having a seamless process in terms of information sharing, among various community partners and so forth. Feedback about ways that they could participate in wraparound team meetings, being a timekeeper, ways that wraparound coordinators could be more creative in the way that they talk about strengths, creating a vision board and those kinds of things. So there are lots of innovative ideas that could be easily used and integrated into the wraparound work that was being done in this community.
Typical way, I know Miriam, who's also with the Center for Community Learning, has worked with some agencies that offer stipends to the CLC committee members, and that can become an incentive or can help remove some barriers that might exist for those participating. And there are innovative and creative ways to fund those stipends that if you have specific questions about, you can email us. Our contact information is on this page, and you can email us with those specific questions regarding if you have questions about funding stipends and that sort of thing. One of the questions that we received was, I'm wondering if you have any advice about how to increase buy-in from stakeholders so they will participate throughout the process. Have you found that there are benefits to implementing the CLAS standards that a wide variety of youth-serving agencies would understand? Has anyone developed or know about a resource infographic list of reasons to participate? And I think we've addressed that, but also I have I have the Broward, I don't know if we have anybody from Broward County One Community Partnership 2 site on here, but they have created a series of their CLC committee along with their youth committee created a series of videos. They sat down and they talked about situations where the CLAS standards had not been implemented, or where they saw situations where the CLAS standards should have applied, and they created videos of those scenarios and how the CLAS standards would have addressed those scenarios. And so this was a way that the youth got involved in creating the videos and in training other service recipients and other participants in what the CLAS standards were and how they were meant to increase the voice of the youth and the voice of participants. I have tried to cut and paste the link. Let me try it one more time and see if I can do it. It didn't work. I'm trying to cut and paste the link from the YouTube. So I can email, if you email anyone who wants that, I can send that to you, or you can also Google OCP2. I'm typing it in Broward County YouTube, and then look at the Cultural Competency channel under their YouTube channel, and you will find there's about almost 8 of them, 8 or so videos that address each and every single CLAS standard. When you look, pretty much all of them, when you look at all the videos. In the chat box, I volunteered Shannon. Somebody asked about CLC terms. Shannon Moreno at the Texas System of Care has a webinar that talks about all the different terminology, from cultural competency to cultural humility, and it addresses all the different terms. And she posted that link right there in the chat box. And you'll now have the YouTube channel as well as the series of podcasts. I recommend the series of podcasts from the Texas System of Care, because they are practical ways of implementing these CLAS standards, particularly the principal CLAS standard at the clinical level, which I think is what we've talked about sometimes is the biggest challenge. We have some more questions coming in, so we have a few minutes, so we'll let someone was typing. If you have questions, type them in, and also feel free to reach out to us. And those of you, many of you I see on this list are part of our CLC roundtable. The roundtable are representatives from systems of care and other grantees that work in the area of CLC. Their primary responsibility is CLC, or they are responsible for the people who champion CLC. And it's a monthly meeting via web-based technology, and we discuss different topics. If that is something that is of interest to you, please email me. We talk about different topics, including the topics that many of you have raised, which is engagement and getting buy-in. And that is and in fact, this month's topic at the end of the month, we meet at the end of the month on a Friday, and this month's topic is going to be on getting buy-in from leadership. Is the roundtable the same as the state CLC network? No. The roundtable is something that the TA network, the Cultural Linguistic Competence team from the TA network has started in response to some TA requests that we've been getting, and it is a supportive community for people doing CLC work, addressing some of the challenges and also sharing best practices. Any other questions? We've put up on the public chat a link to the survey If you all could click on that and take that as we close up. Any parting words, any last thoughts, Selena?
Yeah, when you mentioned the incentives, I wanted to mention too that this particular system of care offered cab rides for youth and families to attend the meeting, and oftentimes youth leads and family leads contributed to the agenda of the CLC meeting. So, for example, like when the Trayvon Martin incident occurred here in Florida, many of the youth said that they needed to talk about some of the emotions, some of the fears that they were having, and so our next CLC meeting was spaced to do that. So I think making sure that you are allowing family members and youth to guide the agenda and, to, in a meaningful way, contribute to the CLC process is also helpful in terms of making sure that you hit on an ongoing basis. So just a few examples.
Thank you all for the great feedback. And in April, correct me if I'm wrong, but somebody, April 4th is our next peer learning exchange webinar, and we are addressing implementation of culture-based wraparound. So while not specific about the CLAS standards, there will be a lot of discussion on implementation of wraparound principles and alignment with the CLAS standards and how you implement those in wraparound. So that will be in April, and registration links will be going out in the next through the TA Telegram in the next couple of weeks. And she just put it up. If you want to go ahead and register for that event, the link is in the private chat. Anything else? If not, thank you very much.
Thank you.